Thank you for joining us, everyone. I'm Ron Corning. Together with Baylor Scott and White Health and FWD DFW, we have a lot to cover today. We're running down, well, don't be a COVIDidiot. Yes, this is a term we've come up with to describe anyone who doesn't listen to the parameters for being safe beyond social distancing. We're going to talk about some of those. Also, the doctor is in. Just because you can't get to your doctor's office doesn't mean your doctor can't get to you. The rise in popularity of telemedicine, how it works, and the question, does it really work effectively? And also, how can you help? How can you help our first responders help you? We've talked about staying home. That's top of mind, but we'll talk about some others as well. And we'll do it with the help of Dr. David Winter from Baylor Scott and White Health, who has really been at the forefront of providing us with information as this pandemic unfolds in ways that we're uncertain about. And I always like to start, Dr. Winter, with you with the good news. Give me the good news headline today.
And there is some good news. So the virus, it looks like, is slowing down in its spread in New York City. Now, this is interesting. It was doubling every 2 days last week. Now it's doubling every 6 days. It's still doubling, but it's starting to get the curve to go down a little bit. That's good news. In China, Wuhan, they're going back to work over there. We kind of worry about, is there going to be a second coming of this virus over there? Worry about that. Washington's getting better. But here in Dallas, we are going the other direction. So last week, we've doubled the number of cases in Texas, doubled the number of cases in Dallas, and doubled at Baylor Scott and White Health. So it's about to take off.
And we're also increasing the amount of testing, so that accounts for some of those numbers. But you said something last week that I think is important, and that was your underlying belief that for every person tested positive, there are many more who are likely not getting tested who also have it. Are we keeping pace with testing versus actual number?
No, well, the testing we're still doing only on folks with symptoms, and we like significant symptoms. If you have mild symptoms of coronavirus, please just stay home. We don't have enough test kits yet. They're coming. And I hope in the next weeks, maybe month, we'll have enough test kits to test everyone. Then we know exactly what the denominator is. Right now, we do not know that.
All right. So we started out here by saying, don't be a COVIDidiot. That is, don't do things that are going to put you at risk or other people at risk. And we know social distancing is part of it. That now extended through April 30th. The minimal standards, and then there are some states and other cities that are taking even more, I would say, a more stringent approach to how we social distance. In our case, non-essential businesses closed, stay-at-home orders, et cetera, shelter in place. Let's talk about delivery. Common questions here. Should I be worried about food delivery?
The food is probably fine. What it's served on may or may not be. I want to assume that the guy in the kitchen who made this thing might have it, but doesn't know he has it. So if you have food delivered to your house, I would take that food, put it on your plates, use your utensils, wash your hands, eat the food, and then wash your hands again.
So there is a level of risk with it. If you can,
very small.
If you can cook at home, you would recommend that. But that lends itself to another question. If I'm cooking at home, I'm buying groceries from a grocery store, canned goods, packaged goods, even let's say a bag of rice or whatever it might be. Other people have, even produce, other people have handled that. How do I should I be disinfecting all my grocery store items?
You know, to me, this virus, Ron, has two talents as far as viruses anyway. One, it's extremely contagious. Number two, it tends to last for a while, at least we think it does, on surfaces. Now, if I get coronavirus on my hand, I can't get it in my body on my hand. It doesn't go through your skin. The only way you get it there is if you touch your face. And so with the groceries, get the groceries, take them out, wash your hands. Even with fruit. I mean, you see people in grocery stores, they're looking at the apple. No, I don't want that one. I'm going to get that one. Okay, I'm going to assume the apple has coronavirus. I'm going to get that apple. I'm going to wash my hands. Then I can eat the apple. All you have to do is wash. This virus is very sensitive to disinfectants and soap and water. If we remember that, we can help arrest the spread of this virus.
How do we stay safe in grocery stores? Because I was at Central Market on Saturday. While people are social distancing outside, they're social distancing at home. The grocery stores are sort of the epicenter of the most activity I've seen, where people are in one place. There are lines on the concrete leading up to the cashier's checkout area, but I'm not seeing people staying 6 feet apart as they're looking for groceries and filling up their carts.
Yeah, the grocery stores I've gone to aren't that busy, so I've been able to do that pretty well. I walk in, and actually I was at Safeway, and I started to disinfect the cart, and here the guy walks up and says, hey, that's my job. Let me do that for you.
Really?
So that was pretty cool. But I'm assuming everything I touch there may be contaminated, so I'm keeping a distance. I don't see anybody coughing or sneezing. If I did, I'm going. But everybody's being pretty mindful. I saw anyway, if it's a busy time, you might leave and go back when it's not as busy. And then when you get home, you're going to just clean everything. Disinfectant, soap and water. I think you're fine. That's a pretty simple rule. If you do that, we should stop the spread of this.
I'm wondering where there's a Safeway. I haven't seen a Safeway
I
in
haven't
DFW.
either.
So that caught
Maybe it
my
was a
attention.
Tom Thumb.
It
I
was
don't know. I
probably a
get
Tom
mixed up.
Thumb. It was, yeah, it just turned into Tom Thumb. Okay, question. What about drive-through?
He
So
went to
I'm-
Denver to get his groceries at Safeway.
It's a very long drive. That's a far place away. Okay, so what about a drive-through? I'm just going to say maybe I drove through a place over the weekend, and not only did I hand my money to the first window, and the change was given back to me hand to hand, and I said, please keep the change. I can't take that from you. And as it was a kind of an unsaid, do you know what's happening in the world? And then I got to the next window to get our sweet treat, and it was handed to me with a hand. And I looked at the man and I said, excuse me. And of course, I've got kids in the car who are very excited about their treat. And I said, excuse me, you don't have any, where are your gloves? And he said, well, we don't do gloves here. And I said, well, then I can't take that from you. And we drove off. And my no treats. And so now I've, forget the money and forget the extra that she got to keep and forget the treats that were waiting. But my kids are in the car and they said, you know what, Mom, we understand you're trying to keep us safe. I was lucky because it really most of the time would have gone the other way with the meltdown. But how are people not wearing gloves? And how is that okay to literally hand someone food hand to hand?
Yeah, that makes me nervous to hear that. One of the best drive-thrus I went through 2 days ago, I went up to put my card, hand the card, and she hands the card reader out. I stuck it in, and I pulled it out. I said, that's perfect. Then when I get the groceries, she was holding the other side of the bag. This was some chicken sandwiches. I grabbed that side. I thought that was perfectly safe. But, take these little wipes when you go in there. And like today, that didn't happen. She took my credit card, handed it back to me. So I took my credit card and I wiped it off and I put it down in there. We got to pay attention to this stuff. You're really good, Melissa, about this because most folks would have just taken that and perhaps gotten coronavirus.
Yeah, it's just not worth it.
But I'm wondering, not in defense of that person at the first window, but we're all carrying some money around. We tend to carry less cash than we used to, but you've got money. You don't know where that money's been.
True.
You pick it up. What if the coronavirus is already on it? Mm-hmm. Even if the person has gloves on, you're handing them money. The change comes back. Maybe the change has it on. I mean, really, because we know it lives on surfaces, we don't really know if the transmission is cut down to a huge degree unless they're disinfecting between every handoff.
Totally agree. So when the money goes in your wallet, you disinfect your hands and you're fine. Or you walk around like this and make sure you don't touch your face until you can wash your hands.
And for a certain amount of days, let's if that coronavirus is on that object, on that money, it will die in, do we know, 3 to 9? I've heard anything from 3 to 9 days.
Here's what they did. They took the live coronavirus and they sprayed it on surfaces. And it was most hardy on plastic. They said it lasted 3 days. Now, I went back and read the study, and they're actually testing the DNA of the RNA of the virus, and it was still there in 3 days. Now, does that mean the virus is alive? Some people said, no, it's not really alive. We don't know. But at least 3 days you have to assume. But as long as we're washing or disinfecting, we're okay. Assume everything is contaminated and just wash before you put your hands on your face. It's a simple rule.
All right, I want to talk bigger picture. And again, we run the risk here of speculating on some unknowns, but I think we know enough so far about how this has played out around the country. Can we begin to project how things will go in a general sense? And we'll have some of those questions when we come back. In the meantime, we want to remind you how you can volunteer with the help of Forward DFW. If you have idle time on your hands, you can use your special gift, your skill set, your superpower. Visit FWD DFW.com, click on the volunteer link, sign up to be a neighbor with VOMO.org. So I have a question for Dr. David Winter to start a conversation here about sort of our future based on what we've learned so far about how this disease has played out really globally. And that is, after the 9/11 terrorist attacks, we all became very mindful of what our government was doing for counterterrorism. Dr. Anthony Fauci has now become a hero in his own right for information about infectious diseases. Is this going to cause for us a shift? Will the public begin to put pressure on government officials? Will it be part of what we're concerned about in our culture that more is done to make sure that all scientists are working toward one goal, and that is to keep ahead of the possibility of a pandemic like this again?
I'd be very surprised if that didn't happen exactly the way you described that. This is the third major major pandemic now in 15 years?
Mm-hmm. SARS was one. We know that Toronto in particular was an area that was infected, but that particular virus wasn't as hardy and didn't last as long, and so
Correct.
It has in no way captured this amount of attention. I know in your world it did, and this is now considered a SARS-like virus, coronavirus. Yep. It's all part of the same family.
And there was MERS before that. It was more deadly, but not as contagious. This is the talent again. It's extremely contagious. So this is a different. What if the next one is extremely contagious and very deadly? We've got a major problem.
Well, that's my question. We talk about it being seasonal, but we don't know what seasonal means. Will our season wrap up when another season begins overseas? And if we see something beginning overseas now, as opposed to last year, if we see something pop up in China this December, that's either part of the same coronavirus family or different, how will our reaction be different?
It's a good question. Hopefully by then we'll have some treatments, and hopefully we'll have a vaccine. The vaccine is the key. Now that's a long way off. I say it's a long way off. It's already been developed. Now, is it good? First, is it safe? And is it good? We don't know that. That's going to take some time in studies to prove. They're saying 12 to 18 months. Now, I wouldn't be surprised if that was ratcheted up because of the intensity of this virus worldwide. But we've got some time to go.
Well, let's talk about an article in the Dallas Morning News over the weekend that talked particularly and specifically about Baylor Scott White Health's research team and their research department working on a possible treatment. This is a drug called remdesivir.
Yep.
What does remdesivir do?
It's an antiviral, so it actually slows the reproduction of the virus down. I really hope this thing works, but I got to add in here quickly, this virus, this COVID-19 virus, is like a cold virus. Now, it's a real bad one, but we've been trying to get a cure for the common cold, Ron, for 50 years.
So the best we've been able to do with the common cold is treat the symptoms.
Yes.
So, short of a vaccine, how close do you think we might be to coming up with a combination of drugs or treatments that help the symptoms so that this disease isn't as fatal as it's been to this point?
We're doing it the right way this time. We missed the opportunity with SARS and MERS. Even bigger example, there were 30,000 people with Ebola. They had all these drugs they threw at the Ebola victims. And did they work or not? We don't even know. There wasn't a controlled clinical trial, and they're doing them now. So we will know scientifically if these drugs work, and hopefully within 6 months or less.
That has become such a point of frustration, and that is what you just said. Those were missed opportunities. In your world, you knew this was a problem. People in the medical community have been lobbying the government to take it seriously, and yet there's been a cutback in government agencies that are specifically orchestrated to work on infectious disease and the possibility of pandemics. Bill Gates has talked about it. He had a TED Talk in 2018 that got 18 million views. It's not as if the infectious disease community hasn't been aware of this. What a shame it's taken this as a wake-up call. We talk a lot about the possibility of, there was a lot of talk about what would a terrorist attack look like before 9/11, and then signs after the fact that perhaps there wasn't enough done to prevent it when it came to our intelligence community. I see a correlation there as well.
This is a wake-up call, no question about that. And we're studying these drugs exactly the way we should, double-blind, placebo-controlled, so we know exactly whether it works or not. Some of these malaria drugs worked well in one viral epidemic, made it worse in another. So you don't want to just throw drugs at people till
To
you
see what
know.
sticks. You just don't want to throw everything at the wall because not everything works. But isn't it interesting? We do have the people, the expertise, and the ability, when needed, to begin to solve these problems in a shorter amount of time than conventional thinking would warrant. Right?
Yes, I'm optimistic we'll have a lot of good lessons we've learned from this. Not only with drugs, but with how we need to socially isolate. Will handshakes go away in the future? That'll be interesting. I mean, do we do the elbow kind of thing? I mean, that's the way we've spread germs for a long time. Probably the reason cold viruses have been so prominent here. You know, another side benefit of this social isolation, the flu epidemic of this past year was about to take off. Where is it now? Social isolation worked for that also.
Interesting.
Well, there's also this change. I mean, you're saying things are different with the way we're seeing doctors.
Yeah, telemedicine, which
Yes.
I've
Yes.
known of Teledoc and some others that are branded. In fact, my last company encouraged us to use that before going to the doctor. I think it helps keep healthcare costs down. Now, as a matter of necessity, people are getting online and Zooming or Skyping or going through this technology, Teledoc, to see their physicians. I remember at one point I did use Teledoc, and I think it was a doctor in Minneapolis who was in queue and available to see me and ask me what my symptoms were, and then prescribe a general antibiotic for, a bronchial infection. Do they work, do you think? Are they a good substitute for seeing your doctor in person in the midst of something like this?
I've been doing these for 2 weeks now. I think they're fantastic.
Had you not considered it before this?
I've done a couple, but I've been so busy in the office, didn't take time to learn that. We've been actually encouraging doctors for 2 years, please try telemedicine. I'm guilty also, didn't have the time for it.
Well, because
Now
I
we're begging it.
suppose you want to have a relationship with your patients and see them and that's
And putting your hand on them and
Yeah,
touching, that's a part
yeah.
of the relationship. But phone call, we do phone calls on the weekend all the time on call. I've done those for years. This is different.
I was going to say, is it different when you can see them?
When you can see them, you can see their body language. You can kind of get a feel for if they're paying attention. You get this. No, it's a whole new way to take care of folks. I think it'll be the new standard of the way we see patients going forward. Some things you just have to see. If you've got right lower quadrant pain, I've got to touch you and see if that's an appendix type of pain or not. But for many other things, I can kind of get your symptoms, look at you there, make sure that I'm seeing things, see if you look sick, if you don't look sick. I think it's going to go a long way to replacing some of the face-to-face visits we've had for years now.
Well, also in the course of treating coronavirus, it's also a good way to rule out early on that someone probably doesn't have it based on those baseline symptoms. And also, I would think, sort of quell a little bit their panic, because there's a lot of anxiety and fear around this. So even seeing you, even if it's on a screen, probably goes some distance toward that, I would think.
Well, there's also some fear and panic with the health professionals. We don't want you actually walking into our office with coronavirus. If you do, we're going to have to shut down our office for 2 weeks. So there's apprehension there also. This works both ways.
All right. Being a mom, having had your children, have you done telemedicine before?
I haven't done it with my kids, but we're getting emails from all the doctors, and I'm not shy to say that we see all kinds of doctors in our family, whether it's a psychiatrist or not. We're getting all the emails, but which surprised me because I would have never thought in a million years that a child psychiatrist would say, this is okay, and here's a safe portal. And you know what? It's a little more efficient, I have to say, that it kind of works. They're at home right now. They can have their visit and get back to their business instead of let's get in the car, waiting room, and all of that. For me, I'm kind of a fan of that. I don't know how it will go after, but for now, this is where we are. And I think that, again, going to a pediatrician's office, and even though you have this sick area, we walk in and we're immediately exposed to so many germs.
Well, and to Dr. Winter's point, it's an opportunity to screen out people whose symptoms can be treated by visually seeing them and hearing more about it so that they don't end up crowding waiting rooms for people who have more serious conditions. Our conversation is going to continue here in a moment, but we want to first remind you how you can be more informed with the help of the Dallas Morning News and Baylor Scott and White Health. Thanks to Forward DFW and Baylor Scott and White Health, the Dallas Morning News is providing public health coverage of coronavirus free of charge. Go to dallasnews.com. All right, more to talk about when it comes to telemedicine. Dr. David Winter joining us from Baylor Scott and White Health. And Admittedly, he said just a couple of weeks ago, even though he'd encouraged colleagues to use it, he hadn't really adopted in many ways telemedicine as a means of treating his patients. And this pandemic has changed your mind in ways that will probably continue beyond this.
Yes, we're doing this right now. Say you have high blood pressure and I want to see you back every 4 months or every 6 months. If you have a blood pressure cuff, I can look at you in telemedicine, take the blood pressure if you would. In fact, it's more reliable there because you don't get the white coat syndrome when you walk in my office.
Where it spikes when you walk through the door. You can feel it. So you can treat chronic things. I'm wondering, as you were telling the story about diabetes, my mom having had it, I would go home and be like, now what are you eating? You think this is healthy and it's not, and I'd open up the cabinet. You could literally say to a patient, show me what's in your cabinet.
Sneak up on them. Yeah, I need to
Really?
see a picture of your refrigerator right now.
Yeah, what's your diet like? Show me what you're doing. Show me what packaged foods you're eating and so forth. They may be misled into thinking something's healthy or good for them when it's not. So you're a fan of that. Social distancing, again, that seems to be the baseline for keeping this from spreading quickly. People are getting increasingly cabin fever. I've been walking in the neighborhood. A lot of people are walking, but that's very different than a bottleneck of people on the Katy Trail, which again, the Dallas Morning News covered that too. Other media outlets have covered it. People are getting upset that social distancing doesn't seem to be in practice in places like the Katy Trail. What would you say to that?
I think social distancing is important, but if somebody's coughing or sneezing, you want to be at least 3 to 4, ideally 6 feet away. Otherwise, you can run by them. I'm not overly concerned about that.
You're not.
It's the touching. We think most of these cases come from your own hands that touch something that they shouldn't have touched, unbeknownst to you.
So the idea of shutting down public parks or the Katy Trail may not necessarily, you think that could be an overreaction?
There's got to be other places you can run. I mean, everybody likes to run on the Katy Trail. I've done that myself. But yeah, if it's crowded, I'm going to go somewhere else right now. I don't want to get that close to somebody for all the reasons. Even though you may not get it that way, I worry about that. But there's got to be other places we need to go to. I hate to see them stop the Katy Trail. That's such a popular place, but it needs to be less populous right now.
Yeah, it was pretty populated on Saturday when the weather was nice. Let's discuss how we can help those who are on the front lines. We're talking about our first responders. The basic first thing we can do is, and we've touched on this, don't go to the hospital unless it's absolutely necessary, unless it's reached that point. What can we do beyond that?
Well, that's a good question. We do have a shortage of masks, of gowns, and we have a lot of people helping with that. We've got enough at Baylor Scott White Health now. In a couple of weeks, we're worried about this steep incline in cases. We may not. We have sources, but you could help with that. We need help with people on the phone, triaging some things, so volunteers are welcome. We're bringing back some of our old retired physicians. Some retired nurses are coming back to work. There's a lot of things we can do.
Yeah.
We need some help. This is going to be tough. You hear the folks in New York City, they really are under siege up there, and there's a lot of fatigue that we haven't seen yet.
When you do a deep dive on this issue of the personal protection equipment, PPE, so when you read PPE, that's what that stands for, correct?
Correct.
There's a lot more, again, in hindsight, there's a lot more we could have done. There was a lot more that infectious disease specialists were telling us we should be doing when it came to manufacturing and stockpiling this equipment. Part of the problem is one of the largest manufacturers of these masks,
China.
Second only to China is Italy. So now you've got two of the countries who could supply for us medical equipment as needed. They're too sick to make it. We're starting to see what a pandemic is in real time.
You know how you're supposed to have diversity in your stock portfolio? We're going to have diversity where we buy medical supplies in the future. That's going to be very, very clear. You know, Baylor Scott White, we're a big system. We have 49 hospitals, but I was surprised when I heard just this week, we typically use 15,000 masks a day. Now we're using 100,000 masks a day.
15,000 to 100,000.
To 100,000 a day because everyone's wearing a mask.
And that's within your entire system?
Yes.
And then you've got other hospital systems all around the country that make up for, which have to be doing the same. So again, in real time, we're seeing what our system can and cannot take. Based on what you're seeing right now, as we wrap this up, hopefully with a sense of optimism, Is it possible that this won't just end, but rather we'll go through some cycles, even of social distancing, that perhaps we'll learn that it's possible for certain people to get it a second time, and therefore we need to practice social distance as part of our social culture moving forward for a very long time?
I think more likely it's people that don't get exposed to it. We think that is looking right now around the world, if you've had it before, you're not getting it the second time. There are a few perhaps exceptions to that, but we think you've got pretty good antibodies there. How long they last is another question. When it comes into a community and it saturates the community to a certain degree and goes away, well, it didn't get everybody. So those other folks are still not immune to it. So that's when it could come back. So we're going to have to social distance for a longer period of time than we ever thought.
That's the point I was getting to. As other people aren't exposed to it and healthier people go back to work because perhaps they've had it and built up antibodies, does that mean there will be pockets of social distancing where you're back in the office, but I'm not?
We need to be able to test everyone and figure out where is it actually silently. These kids who don't get it, many of us are pretty convinced they probably are a vector. They probably have it silently and they're spreading it around.
And until we know that there's an effective vaccine, these are the questions that will remain.
Indeed.
And we'll see how it plays out. One final question related to that came to mind as you were talking about those who've had it. That's convalescent plasma. I believe that's this notion that if you've had it and you've built up antibodies to
Correct.
it, you could provide a solution and treatment for others who have it. We saw that with the doctor who had Ebola and recovered. He provided the antibodies for the nurses in Dallas who became sick from patient zero. How is that all taking shape as it relates to
I think it's
coronavirus?
very promising. We don't know for sure if it's going to work. I'm optimistic that it probably will. Now, when your own body builds up antibodies, it continues with a memory to put out those antibodies. If you get somebody else's antibodies, they may work well, but it's like one shot of penicillin. Sometimes you need several shots of penicillin for a bacterial infection. Penicillin doesn't work for coronavirus. But the antibodies are a short-term solution that may work. Hopefully, we'll find out that pretty soon.
Yeah, we appreciate you guiding us through it.
Good to be here,
I would say every week there are new questions. Literally, this is in some cases hour by hour.
We're learning something every day about this vaccine, about this virus.
Well, and thank you for shedding light on it and passing it on. We appreciate it.
Good to be
Dr.
here with
David
you.
Winter with Baylor Scott and White Health. If you have any questions, please log on to the Dallas Morning News or the Forward DFW Facebook page. Post them there, and we'll have Dr. Winter answer your questions. We'll see you next time. Special thanks to Forward DFW's founding and supporting partners for making this coverage possible. Forward DFW was created in partnership with the Dallas Morning News. The goal? To connect companies, causes, and the community, and face issues that impact the economy and wellness of North Texas.